Hello, this is Dr. Grant Cooper from Princeton Spine and Joint Center. In the next 7 minutes, I'm going to tell you everything you'll ever need to know about golfer's elbow. First off, what is it? Well, golfer's elbow is also called medial epicondylitis, and it's an inflammation of the flexor tendons in the forearm that attach to the bony prominence in the elbow called the medial epicondyle over here. While not as common as its better known cousin tennis elbow, golfer's elbow is still a very common cause of elbow pain. It's usually a very easy diagnosis to make. The patient will come in and they'll have pain along the medial aspect or on the inside of the forearm, over here, right on the inside. Usually the pain is most severe at or around the insertion of the flexor tendon at the medial epicondyle up by the elbow. Resisted flexion reproduces the pain. There shouldn't be any associated numbness or tingling, and reflexes should be normal. The arm and grip strength may feel weak secondary to the pain. Now, interestingly, while golfers are definitely at risk for getting golfer's elbow, although how funny would it be if golfers never got golfer's elbow? But they do. They do get it. Still, most people who get golfer's elbow don't play golf. In fact, interestingly, many tennis players and other racket players develop golfer's elbow, particularly if they're using a racket that's either too light or too heavy. Also, as with tennis elbow, any activity that involves repetitive motion of the wrist or arm are at risk for golfer's elbow. For example, plumbers, painters, construction workers, musicians, gardeners are all at risk for golfer's elbow. Also, people who play throwing sports are at risk, such as baseball players, javelin throwers, bowlers. Now, in golfer's elbow or medial epicondylitis, strain on the tendon leads to inflammation, or it can also lead to micro tears in the tendon that then leads to inflammation. Now, inflammation is a protein response that causes pain and sometimes swelling. The best way to think about inflammation is that it's like a fire, and there are two ways of putting out a fire. One is to move away all the fodder, right? You move away the fodder and you let the fire die down on its own. For golfer's elbow, this is primarily with rest, exercises, and bracing. Resting the elbow from the offending activity is important. Now, golfer's elbow is a repetitive stress injury, and if you keep on doing the offending activity without modifying it, you don't give it a chance to heal. So rest, at least for a while, which can mean a few days to a month or longer depending on the severity of the case, is important. Now, the exercises seek to stretch and strengthen the appropriate muscles in order to take the pressure off of the tendon itself and allow it to heal. For these exercises, you can check out our video on golfer's elbow exercises. Another approach to move away the fodder and let the fire die down is with bracing. Specifically, a golfer's elbow counterforce brace, which you could pick up on Amazon or at any medical supply store, is a slim brace that goes around your forearm, and you line up the gel or cushion with the pain about 2 centimeters downstream or distal to the site of pain. The idea of this brace is that it redistributes the forces away from the inflamed tendon and spreads the forces out to the rest of your forearm. It's a nice idea, and some people with golfer's elbow have absolutely sworn by the braces, while others don't get any relief from them at all. And it's really hard to tell who's going to benefit from a brace and who's going to think it's useless. So it's certainly not a panacea, but I think it's something to consider trying. Now, the other way to put out a fire is with a fire hose. A great fire hose for golfer's elbow, believe it or not, is ice. Applying ice for 15 to 20 minutes every 4 to 6 hours for a couple of days can be very beneficial. This is especially helpful to try when the pain first starts. Also, topical NSAIDs, or non-steroidal anti-inflammatory drugs like over-the-counter Voltaren gel or Flector patch, or there's prescription-strength Pennsaid, can be very helpful in addition to the ice. The reason that ice and topical NSAIDs can work so well for golfer's elbow is that the NSAID and the cold from the ice diffuse directly through the skin, and the tendon's very close to the surface of the skin, so the medication and the cold can actually reach it. Right, this is in contrast to problems that are deeper in the body, like hip arthritis or spinal stenosis, where a topical medication just isn't going to diffuse deep enough to make a true difference at the source of the problem. So ice and topical NSAIDs are good first-line choices. You can also take oral NSAIDs, like sElbowRelief, for example. But here the problem is that not much of the oral medication will actually get to the tendon site where the inflammation is. So generally I prefer topical NSAIDs for this purpose. Also, you're going to have fewer side effects with topical NSAIDs as opposed to oral NSAIDs. Now, injecting steroids under ultrasound guidance into the tendon sheath is another option. This has mixed reviews in the literature, with most studies showing excellent short-term relief, but not all studies showing good long-term relief. Now, one thing is certain: if you do use steroids to calm down the inflammation, then the tendon is going to need time to rest and then time to gradually strengthen with exercises before you consider returning to sport, so that you don't worsen the problem. Also, repeated steroid injections can be problematic by weakening the tendon. Most physicians, if they are going to recommend a steroid injection for golfer's elbow, would recommend no more than 3 steroid injections for the tendon within a year or 2. And you want to space each steroid injection out by at least a month in time. Now, physical therapy can be very helpful for golfer's elbow as well, not just because of the therapeutic exercises that the therapist can review with you, which are certainly important, but therapists can also use their passive modalities like ultrasound and electrical stimulation units, as well as soft tissue manipulation. Golfer's elbow that's not improving with good conservative care is actually an excellent candidate for regenerative medicine techniques such as PRP, which is platelet-rich plasma. Now, platelet-rich plasma is where the patient's blood is aspirated, and then you spin down in a centrifuge to isolate the platelets and the platelet growth factors, and then you take that aspirate and you inject it back into the patient's body at the pathologic site with the aim of stimulating the body to essentially heal itself. There are also other regenerative medicine techniques like prolotherapy, amniotic fluid injections. The main detractor from these techniques is frankly the cost. As none of these techniques are proven treatments, insurance almost never covers any of them, and they can be quite expensive, ranging from $750 to $3,000 and more, depending on the particular doctor and the particular treatment being considered. So cost is a good reason to not use it immediately, but from a clinical perspective, it remains an attractive option. If you took cost out of it, personally, I would prefer to use PRP, for example, rather than steroid injections for patients with difficult to treat golfer's elbow. But cost is an issue, and all of these things should be discussed between the patient and the doctor. Now, surgery is another option for golfer's elbow, particularly when there's a partial tear of the tendon. But it is a measure of last resort, and it's not generally necessary. Still, it can be quite effective to debride and repair a torn tendon. That's it. I think we went a little over 7 minutes. I hope you've still found this video about golfer's elbow useful. And if you have enjoyed it and if you've learned something, then please remember to like this video, subscribe to the channel, and tell a friend who might enjoy it as well, because that's the way that we can spread good health information and achieve good health outcomes together. As always, if you have any questions you'd like me to answer in a future video, or if you have any comments, you can reach me at drcooper@princetonsjc.com, or feel free to leave a comment in the comments section. Thank you very much.